Breast cracks, also known as nipple fissures, are painful cracks or splits that can develop on the nipple, often appearing on one or both breasts. They are commonly caused by breastfeeding, especially if the baby isn't latching properly, but they can also result from chafing, dry skin, or other irritations. These cracks can range from small red lines to deeper fissures, sometimes even leading to bleeding. While they can be uncomfortable, the good news is that they are treatable and preventable with the right care. Let's dive into how you can avoid and heal cracked nipples to make breastfeeding a more comfortable experience. At the beginning, there may be no visible signs, and it might seem like nothing is wrong. However, as you start breastfeeding, you'll notice a slight pain when the baby sucks. If nothing is done to prevent it from getting worse, small red lines may appear on the surface of the nipple, or cracks might develop, sometimes even leading to bleeding. So, it's important to take steps early to avoid this discomfort. First, it's crucial to position your baby correctly. Make sure your baby is facing the breast directly, so they're not pulling or pinching the nipple. A good portion of the lower areola, the darker area around the nipple, should be covered by your baby's mouth. Their lips should be flanged outward, and their tongue should be under the breast, not just at the tip of the nipple. This helps reduce pressure on the nipple itself. If you need to clear your baby's nose to help them breathe, don't pull on the nipple with your fingers. Instead, bring your baby closer by pressing their bottom against you, and their nose will naturally clear. Another key tip is to avoid overwashing or overdrying your nipples. Doing so can strip away the natural protective layer of fat that keeps the skin healthy. Cleaning once a day with a mild soap is plenty. Also, wearing a well-fitted bra can help prevent friction, which can irritate the nipples further. When it's time to remove your baby from the breast, gently slide a finger between their gums to ease their mouth off the nipple. This helps avoid unnecessary tugging. After each feeding, try expressing a few drops of breast milk and spreading it over your nipple. Let it air dry before covering your breasts. Breast milk is amazing. It hydrates, protects, and helps heal the skin. In fact, it's more effective than any cream you could buy. Now, if you already have a crack, don't worry. There are ways to treat it. Start by varying your breastfeeding positions. Moving your baby's mouth to different spots can help rest the area where the crack is located. You can also create a milk dressing to help it heal. Just express some breast milk, soak a sterile compress, make sure it's larger than the areola, in it, and place it over the nipple. Cover it with plastic wrap and secure it with your bra. Change the compress before each feeding until the crack heals. This means replacing the compress with a fresh one every time before you breastfeed your baby, and you should keep doing this until the crack is fully healed. This helps keep the area clean, promotes healing, and ensures the treatment remains effective. Even if you notice a little bleeding, it's safe to continue breastfeeding. Don't worry if your baby swallows a small amount of blood. It's not harmful. But if the cracks are really painful, you can temporarily use a nipple shield or express your milk manually or with a pump and feed it to your baby. This gives your nipples a chance to heal while still providing your baby with all the nutrients they need. Thanks for watching, and remember to like, share, and subscribe for more health tips.